It's a faster, easier way to get your medication through Intermountain Health. I want to introduce you to Mason Hilton, who is the Pharmacy Services Director for Intermountain Health. Thank you for being here.
Morgan, thank you for having me.
Tell us about the on-demand services that you guys have actually been providing, but just making it easier for us to get.
Yes, I mean, we've all grown accustomed to just getting things when we want it, how we want it. Now we're trying to bring that into healthcare.
Okay, all right, so what does this expansion look like?
So what we do is people can go online to intermountain.org. They can fill out a questionnaire. There's services like birth control, athlete's foot, things where they're low acuity, somebody that's not real sick, there's not a lot of risk. Pharmacists will review that online questionnaire, and if there's no risk, they'll send the medication directly to the patient's home.
So you're skipping the doctor?
Correct.
Okay, what is the cost involved in this?
So usually it's $20 to $50 depending on what service you're looking for. We have hair loss, we have women's health, men's health services. So the $20 to $50 for the questionnaire and then the cost of the medication.
So basically a copay. You're going to pay for the prescription anyway.
Right.
So, and you're going to pay for that copay, but now we're not having to drive into the doctor's office, interrupt our entire lives for a simple medication.
Yeah, I mean, it's reducing the burden and improving the access. And part of Intermountain Health, we have a goal to just expand access and to bring that healthcare closer to home.
And speaking of expanding access, you guys aren't just here in Utah. Like, you're helping all of our neighboring states too.
Yeah, we're looking at Intermountain's footprint and it's getting larger and larger. We're helping patients here in Utah, patients in Nevada, patients in Montana, Idaho, across the board. Wow,
you guys have your hand in a lot of things. And I must mention that behind us is a beautiful shot of one of the Intermountain buildings. I think it's the fourth. Let's see, it's hard to tell, it's kind of grainy. But I was told before we went on air, there was like one of your buildings behind us. Anyway, it's gorgeous out there today, unlike it has been in the weeks past, right?
It is a nice day, yep.
And speaking of snow and weather, obviously that can impact people's chance to get into the doctor.
There's so many things that are just burdens to receiving care. I'm trying to get to the facility, trying to schedule an appointment with a provider. Yeah. This eliminates all of those burdens. You can do it, like pull out your smartphone, pull out your tablet, go online, fill out the questionnaire, and all of a sudden medication is on your way to your home.
So what type of things does this include, the on-demand service?
Yeah, so this includes really low acuity medications, so birth control, hair loss, athlete's foot, those type of things, but we've just expanded into at-home lab draws, where somebody that needs to get some blood work done now doesn't need to go into a lab, have that work done. They can schedule an appointment. Phlebotomist will come directly to their home, do the lab draw, and then within just a couple days they'll have their results.
Oh wow, okay, so we're not poking ourselves.
right, no, we have skilled phlebotomists come.
Okay,
yep.
That is extremely helpful, especially for our older folks.
Absolutely. Looking at even cancer screening, we've recognized there's a lot of people that are missing out on some of those preventative screenings, so we've included that as well. Now, same thing, online, fill out a questionnaire, and the kit to do your own screening is come to your house. You complete the kit, send it into the lab, and you'll know shortly thereafter. The beautiful thing about this is we're talking about some of these low-risk medications, but if anybody does risk out and they're at higher risk, we have a referral process where we bring them right into our health system.
Okay, and of course the cost will remain the same, between like $20, $50 plus the cost of the prescription.
Correct.
All right, Mason Hilton, thank you so much for introducing us to the on-demand services and the expansion to that access. We appreciate your help there. You can find more information, you saw there at the bottom of your screen, but it'll also be posted to our website at fox13now.com/theplace. Thanks again.
Thank you.
Yeah, all right, Jenny, over to you.